like to introduce my friend Susan MacDonald. She's the Director of Comprehensive Ophthalmology at the Leahy Clinic in Massachusetts. She's also a professor at Tufts University. She's also Vice President of Women in Ophthalmology, and she's also very active in the Moran Eye Center and Moran Outreach Program. She's passionate about volunteering for a mission of reducing world blindness. She volunteers for the Salvadoran Association for Rural Health, and she also works in Haiti and Guatemala. Welcome, Susan.
Thank you. Thank you. So thank you so much for including me in this program. And so Lisa has you all excited to go, so let me squash all that by telling you how to stay safe in that. And I don't want to scare anyone, but I really think it's important for us. So I'm going to talk about your pre-trip, during your trip, and post-trip. And anyone who is traveling for your first time, I think it's really important to go to a travel clinic. It's going to make this very easy for you and save an enormous amount of time on researching how to keep yourself safe. If you're going to go to a travel clinic, you can either find one that is in your local university, or if the CDC has a fabulous website, and part of that they have a list of travel clinics throughout the United States. During the travel clinic, they're going to address your current health, they're going to update your vaccines, customize your recommendations to the area that you're traveling in, and probably give you recommendations for diseases that you may be exposed to, such as traveler's diarrhea and malaria. And they're going to review some measures that you can take to reduce your risk while you travel. It's also a great resource that if you do get home and have a persistent problem that you've picked up during your travels, that they'll have your medical history and be able to help you. So you're going to be updated on all of your adult routine vaccines, and they'll also look to see if you're going to an area that has meningococcal, pneumococcal, and if you have a need for hepatitis A, typhoid fever, or yellow fever. I wanted to talk about two particular vector-borne diseases because I think they're important, and those are malaria and the Zika virus. Malaria prevention is country-specific. You have to identify your relative risk, the species of the malaria, and drug resistance. CDC has a wonderful website, and they have this great map to show you can look at the country you're in, and specifically in the region you're going to be heading to see what your relative risk is, and also find the drug-resistant strains there so that you're getting the proper medication. Again, if you're going to a travel clinic, they're going to do this for you. The Zika virus, I think, is something that's coming up, and I think it's really important that we talk about it here. Zika virus was first discovered in monkeys in the late 1940s. It was transmitted to humans in the 1960s in Nigeria. There have been small outbreaks in the 70s in Malaysia, and recently in Micronesia, and in the French Polynesia, and most recently in South America. It's a very mild presentation of a virus, conjunctivitis, headache, joint pain, and rash. And what people are identifying is a lot of people, 80% of people that are exposed to it will not even identify this as a disease process. You'll be exposed to it, and you might have a mild fever for a day or two. The symptoms last 2 to 7 days. The problem is that there's been an association with microencephaly. When they look back in French Polynesia, there were 8 cases of microencephaly, and the risk for a pregnant woman being exposed to Zika was about 1 in 100. In Brazil, when they had their epidemic of Zika infection, especially in northern Brazil, what they found is that in December of last year, they found that there was a report of 1,248 cases of microencephaly. This was a huge jump in the report, and it was Brazil ordered a state of emergency because of this. The CDC became involved, and as an update on the numbers of May of this year is that there have been 4,863 cases of the Zika virus, and the risk of a woman who's pregnant being exposed to a Zika virus and having abnormalities in the fetus are about 20 in 100. This prompted a report by the New England Journal of Medicine because there was some discussion of whether or not it was the Zika virus versus pesticides that were being used for the Zika virus. So it's hard to prove this. It's hard to have a smoking gun, but this was such a devastating birth defect that this was evaluated by Rasmussen and al. And there was, they went through a process of deciding whether or not there was causality to put out a warning about this, and they found in evidence that Zika does cause this birth defect. So the CDC and the New England Journal of Medicine have concluded that Zika is the cause of microencephaly in fetuses and babies born to mother infected by this. Now, what does that mean to you and I and anybody that's of reproductive age? So what it means is that any woman that is pregnant should not travel to a Zika area. Women that are of reproductive age that are traveling to a Zika area, that you should wait at least 8 weeks before the onset of trying to become pregnant. That means birth control needs to be used. So but what's astonishing to me is the recommendations for men. And the reason why the recommendations have changed for men is that they have found in male semen up to 6 months, 62 days, they've found the RNA virus in male semen. So that the recommendation, if a man with Zika virus has been exposed, to wait 6 months before attempting to conception. Also, men who have Zika symptoms and are diagnosed with Zika should use have protected sex for the next 6 months. A man who has traveled into the Zika area but does not have symptoms should still use a condom for 8 weeks to protect their sex partners. And men who have traveled in the Zika area and have a pregnant partner should use condoms or not have sex during that entire pregnancy. That's pretty dramatic, I think, but I think it's something that, well, you sort of think, well, my wife won't come with me, or and I'll go by myself. But as a male, if you have, you really need to keep those in your forefront of your mind before you're even deciding to travel. So this is the area that Zika is actually present. And we should all remember you can reduce your risk. These mosquitoes bite during the day, so your exposure can be reduced by wearing long sleeve shirts, long pants, using insect repellent, sleeping under mosquito netting, and using treated clothing. So, sorry for that news. Now let's go on to something more exciting. Traveler's diarrhea. You have a 30 to 70% chance of getting traveler's diarrhea. 80 to 85% of the time it's bacterial, and it's usually from food, not water. So there are recommendations, again, on the CDC that will tell you how to reduce your risk, and that is really some smart to avoid any unpasteurized dairy products, any foods that are not served hot, and eating raw vegetables that haven't been washed is to be avoided. Drinking, again, is you want to make sure you're drinking bottled water or carbonated drinks that have you can guarantee that they haven't been contaminated. Don't drink tap water or ice made from tap water. But with your traveler's appointment, they're going to give you a self-treatment when you do get travelers, if you do, when you do. And the treatment is usually with a fluoroquinolone, 500 milligrams BID to 1 to 3 days, or some are changing to more of a Z-Pak with a azithromycin, 1 gram, 1 dose. Also, having Pepto-Bismol on board is useful, having loperamide, and having just buying a couple. You can buy them at REI or you can buy just some rehydration packs that you put into a bottle of water to help yourself. Also, since we're dealing with, we're operating, we need to talk about what about HIV exposure. So there's a post-exposure prophylaxis that the United States has, and that's treatment within 72 hours with 3 antiretroviral drugs. When I travel with the Malaria, and I feel really comfortable because we have that. So one of the things I'm recommending is whoever you're traveling with, you want to ask them, do you have an HIV protocol? One of the most important things is try to get blood of the person that you've been contaminated with so that you can see what your risks are once you get home. But start the drug within 72 hours, follow up with your infectious disease, and then the drug prophylaxis, the drug should be taken for 28 days, but once you follow up with your infectious disease department, they will change that depending on your exposure. So these are the 3 drugs currently recommended in the United States for post-exposure prophylaxis. If you do get sick while traveling, you need to make sure that you know of a hospital that you feel comfortable going to. The resources can be the Joint Commission does do international evaluations of hospitals, so you can check on the Joint Commission's international site, also with your embassy or your consulate and if you're starting to get sick, the time to check is before you're desperate and need aggressive care. And also ask your hosts for this. In the best case scenario, you should probably research this before you go. So then that comes into insurance. Well, who's going to pay for you while you're there? Well, there's 3 types of insurance. One is protecting your financial investment for your trip, and that's travel insurance, but that does not necessarily cover your health care. So you need to get medical insurance and also evacuation insurance. And finally, I want to just talk about security. There's a wonderful resource for U.S. citizens, and that's called STEP. It's the Smart Traveler Enrollment Program with the U.S. government, that when you enroll in this and you tell them where you're going, this information is sent to your embassy or your consulate in that country. They're a great resource for you in case of an emergency. This is a real picture of me and our travelers in Haiti during the election period. They had sent us an advisory to limit traveling because of the potential riots, and we didn't pay attention to it. So while we had faced this blockade with the fires, the embassy called me on my phone and kind of talked us through it. So it was really useful to have them, and they gave us great advice. Another issue is to ask the team that you are traveling with if it is a violent area. I spend a lot of time in Guatemala, and it has one of the highest murder rates in the world. So we have an actual security team that travels with us, and I think that's a really important part of having and listening to them. Cultural awareness is really critical to understand the culture you're going to. Whether you're a woman or a man, but that is a great way. And listening to your hosts. Your hosts can tell you and protect you and recommend where you should and shouldn't go. I think having contact numbers is critical. Your embassy number or your consulate's number in your phone, leaving a copy of that at home with your emergency contact information. Credit card notification is really important. If you need to spend money to get a flight out, if you don't tell your credit card company that you're traveling, they may not authorize the purchase, so you want to make sure you have that. And also cash. I think this is a balance of having too much cash versus not enough, but the way we got out of this particular situation was with cash. We just paid these guys and they let us through. And I think it's really important. The other thing I did that was really wrong here is I didn't charge my phone the night before, and so I had I didn't have very much memory or power left, and that was really anxiety provoking. So having your phone charged when you're traveling and having an extra charger in there. So now that all sounds really scary, but the reality is most Americans, when they are overseas, the number one killer is motor vehicle crashes. So the reality is you're probably going to be very safe if you're very smart, but you need to be careful on what you're choosing as far as what cars you're riding in, making sure you're using your seat belts and that your driver is safe. And finally, returning home. I think this is something that we don't talk about that much, but I think every time I go, I come home and I get these post-trip blues. I get a little bit of culture shock just being without and being around people that have so little and coming back. I think it's really a challenge. And I think you need to reach out to other people who have been on your trip and just kind of debrief and support each other during that time. I think it's also important to monitor your health when you get home. If you do have persistent diarrhea, if you do have persistent fever, go back to your travel clinic and get some help. And remember, if you're exposed to the Zika virus, I hope you're having sex, but it should be protected. These are the websites that I mentioned. I'll leave that up for a second, so you can take a photo of that if you want to. These resources will make it really simple for you. The CDC also has apps for your phone, an app that will tell you what you need while you're away, what to pack, and they also have a should you eat it, should you not eat it app, which is also helpful.